Hello, my name is Anna, and for my HOSA clinical specialty event, I will be demonstrating heart auscultations. The first thing you will need to do is to introduce yourself to the patient and explain what you will be doing. Hello, Mr. Brandon. I am Anna, and today I will be listening to your heart sounds.
Hello, Miss Anna.
Next thing you'll need to do is to practice some personal hygiene. First, you'll need to sanitize your hands. This is either done by washing your hands or hand sanitizer in my situation. Next, you'll need to put on some gloves. If your patient is wearing any excessive clothing, you may need to ask them to remove it, and you'll need to do the same if they have anything in their front shirt pockets. So, Mr. Brandon, please remove your jacket.
Yes, ma'am.
Next, you'll need to put on your stethoscope. When you're putting on your stethoscope, there are certain things you need to know about it. First, you need to know about the head of the stethoscope. There are two sides, the diaphragm and the bell. The diaphragm is very good for low-pitched noises, and the bell is good for high-pitched noises. In addition, you need to pay attention to the earpieces. The earpieces are at an angle, and they need to be facing inwards as if they're pointing towards your eyes. Now you need to make sure that you are listening to the right side, and you do so by twisting the head. You will lightly tap to make sure you are on the right setting. We are going to start with a diaphragm. Here on Brandon, I have put on a shirt and drawn certain areas that we need to look at to maintain Brandon's privacy. Here we have his midline, and here I have drawn his nipple line. When we are listening to his heart, first we will start with the aortic area. This is the right second interspace. It is named so because we always talk about the side of the patient. It is the second interspace because it is his second intercostal space between his ribs. Then we will move on to his left second interspace, which is the same thing but on the left side. Now we are moving into the pulmonary area. As we move down, we will go into the left third interspace. We are now going to move on to the left fourth and fifth interspaces. This is the tricuspid area. Finally, we will move on to the apex of the heart. Now this is the mitral area. This is the very base of the heart. You need to be doing so with moderate pressure to be sure that you really get subcutaneous sounds. Now we will switch to the bell side. Tap it to be sure you have switched to the right setting. Once again, we will listen to the fourth and the fifth, and finally the apex. Now you're going to want to listen to the patient's carotid arteries. When you're doing so, you need to be sure to apply relatively gentle pressure. If the arteries have a lot of plaque buildup, you are at risk of releasing those plaques, which may then travel up to the brain. To do the listening, you will need to ask the patient to tilt his head upwards to look towards the ceiling. Again, applying gentle pressure, we will listen to his carotid arteries. Be sure to listen to one at a time because we don't want to ever cut off blood flow to the brain. Now that we have listened to Brandon's heart sounds, we will tell him anything we heard. Brandon, thank you for letting me listen to your heart. You had a very normal rhythm. It was between 60 and 100 beats per minute, and I heard a very normal rhythm. You are a very healthy boy.
Thank you, Miss Yammine.
Thank you, Brandon.